Here all morning talking to Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services, and of course we're sitting in their brand new classroom at their brand new clinic here in Georgetown. Thanks for sticking around, buddy.
Yeah.
All right, look, there's a lot of conversation. It's something we should all be concerned about. Of course, you know, we've been tested, we've also done our temperature checks, we've been washing our hands, hence why we don't have our masks on right now. But everyone that comes into the clinic, let's talk COVID and the symptoms. What's expected when you're coming into the clinic here?
So masks are required here. Everybody that comes in, patients have to have a mask. Our staff will have a mask when they're in patient contact as well. We've got hand sanitizers everywhere for the patients, and we'll do immediate temperature checks when they come in the office, which is the standard that we will do, you know, in the midst of COVID right now.
And that's super important, everyone. We want everyone to know that no matter what we're doing, we're always putting your best foot forward to keep your health and safety at ease, right?
Yeah.
Well, let's talk about COVID, everyone, when it comes to what do we know about poor outcomes with COVID and underlying health issues.
Well, you know, I think the first thing that people recall about COVID is they heard about the elderly.
Yeah.
You know, the older patient, and yes, those patients tend to have worse outcomes. But the top two predictors of a poor outcome with COVID, meaning those patients that get really sick or could possibly die from it, are morbid obesity and diabetes. That's what we treat. All of our patients obviously have morbid obesity, and the majority of our patients battle with diabetes. And so I think it's really raised awareness for people looking at weight loss surgery, because the unfortunate thing is COVID isn't going anywhere. No. And who knows when the next thing will come around, and we have to put ourselves in a position to be able to handle it and go on about our life and not be at high risk if there's anything that we can do. And so we've seen an increase in patients seeking us out for that reason. That was the wake-up call for them. Not, you know, I can't sit in the movie theater chair. That's a wake-up call for some people. It's the wake-up call of, wow, I had a loved one die, and the doctor told me because of their obesity and diabetes, that was a factor in that. And I do want to be around for my kids, but I have to put myself in a situation where I could withstand something like this.
Are the symptoms slightly different? So when I say this to you, from someone who, like me, who's not morbidly obese, and maybe I've contracted COVID-19, and someone who is morbidly obese, are their symptoms different with COVID?
I wouldn't say that they're different. I would say that they typically are more magnified.
Right.
You know, if you get a fever and chills and you have a cough and you just stay at home for a couple days like you would get the flu, and then it passes on, you know, you felt lousy, but it really didn't have an impact on your life. You're not admitted to the hospital. You may not end up on a ventilator. And that's the other thing. We know a lot of these patients end up in respiratory failure and on a vent. And you take somebody who's morbidly obese, it's a very difficult process to manage those patients on a ventilator, especially in COVID. We're finding they need prone ventilation. They need to be rotated. They need to be face down. And having the equipment to be able to accommodate those patients, putting themselves in a situation and a weight where they can be cared for easier down the road, whether it be from COVID or any other illness.
I think that's the most important thing, that you're explaining those situations. But I want to also ask you, are you accepting new patients, and are you actually physically doing surgeries right now?
Absolutely. We're as busy as we've ever been. We just have all these protocols in place to make sure that we keep everybody as safe as we possibly can throughout the process. We're accepting new patients, and now in this new facility, we can bring patients in and keep adequate social distancing rules in place, where we were limited before on how many we could bring in. We had to reduce our volume. Now we can accommodate as many patients as we need to. Very
quickly, why did you feel the need to open up such a big space?
We were outgrowing where we were. We needed more room. We had more patients. We needed room for them, and we needed to expand our ancillary services to them that we can give them.
I think it's fantastic. Congratulations.
Thank you.
If you want to find out more information, there it all is up on the screen for you. Georgetown Bariatrics and Advanced Surgical Services. Give them a call if you're wanting to start your new year on the right track.